Giving birth thousands of years ago carried enormous risks. Without modern hospitals, the days immediately following delivery were a highly vulnerable window where severe fevers and physical exhaustion frequently threatened a new mother's life. To fight this crisis, ancient Indian physicians developed a precise medical protocol known as Dashmula, a potent decoction made by boiling 10 specific plant roots. This 10-root blend was a calculated medical intervention designed to keep mothers alive through those critical first weeks. It became the standard of care across the subcontinent. To understand how this formula actually preserved life, we have to isolate and decode its most critical foundational ingredient. Out of hundreds of documented medicinal plants, ancient practitioners chose a small, purple-flowered shrub called Shalparni. In the classic texts, it is listed as the absolute first ingredient in the Dashmula sequence. The Atharva Veda explicitly names Shalparni the queen of herbs. The text claims this specific root cures severe fevers and provides critical strength during childbirth. These physicians were observing real biological reactions, pointing us toward a massive cache of complex chemistry hidden within the plant. Look at the Charaka Samhita and the works of Vagbhata. Both texts prescribe Shalparni to treat aggressive, debilitating fevers in both children and adults. Modern pharmacologists tested these ancient claims at a microscopic level. They worked to extract the plant's compounds to see exactly what was fighting these infections. Researchers isolated a complex compound called aterocarpin and named it Gangetin. Gangetin acts as a targeted anti-malarial agent. In laboratory tests, it binds directly to Plasmodium falciparum, the parasite responsible for the deadliest form of malaria, and neutralizes it. For most of the 20th century, our primary method for fighting mosquito-borne fevers involved environmental eradication, spraying heavy chemicals across swamps to kill the insects themselves. Long before those methods existed, Ayurvedic texts were deploying targeted botanical chemical warfare directly into the human bloodstream to clear the infection. The ancient surgeon Sushruta utilized the exact same plant for a different problem. He prescribed Shalparni root extracts to treat severe diarrhea and irritable bowel syndrome. This microscopic view shows the mechanism. The plant contains Desmodin, a flavonoid that provides cellular protection. When ingested, Desmodin goes to work in the gut. It acts as an antibacterial agent, fighting local infections while reducing inflammation in the intestinal lining. Shalparni produces distinct chemical sets that resolve gut infection while simultaneously neutralizing systemic fevers. This brings us back to the original crisis, maternal survival. The oldest text claims Shalparni restores physical strength and stimulates breast milk production after delivery. Modern analysis confirms the root has a galactagogue effect. Its chemistry successfully stimulates the secretion of prolactin, the hormone responsible for milk production. To handle postpartum exhaustion, Shalparni also functions as an adaptogen. It regulates cortisol levels in the brain, helping a depleted body manage stress and recover stamina. When the ancient sages described a root granting profound bodily strength, they were accurately observing advanced hormonal and immunological regulation. We have ancient Sanskrit verses written on palm leaves, and we have empirical, peer-reviewed molecular structures. Ayurvedic texts represent a massive archive of foundational pharmacology, refined through thousands of years of human observation. Whether using Dashmula for postpartum recovery, fighting a viral fever, or restoring gut health, the chemistry of Shalparni remains as relevant today as it was millennia ago. The chemical profiles within the Queen of Herbs connect millennia of clinical data to modern medical practice. Always consult a qualified Vaidya before beginning any traditional treatment.